Okay, on this video we're going to show how to create the patient chart. We're going to go double click the icon, the MEDSYS2 icon. We're going to use the Sue Smith ID which we created in the previous video. Once we log in, double click on the patient chart. Hit the button that says create new chart. In this case we're going to enter Terry D. Jacobs. We're going to select a case type for nursing. Now the case type will vary based on the type of provider. So once we create the profile for Terry D. Jacobs, the nurse will use this particular chart. We will simply go in and change the type to PT and then save it, and that will actually create a duplicate chart, but that will be for the physical therapist, and then we can also do one for the occupational therapist or speech pathologist. So we're going to go ahead and finish entering in her demographics, her phone number, social security. Once we enter the date of birth, the system will calculate her age. In this case she's 75 years old. We'll enter the claim number here on the first sheet of the patient chart. We'll select the one carrying home care as the service location, and the provider is Sue Smith. And we can enter in her gender, marital status, hand dominance. And race and ethnicity. We'll save the chart. Now we'll go ahead and enter in her emergency contact. In this case it's her son. Now if you see the icon that's right next to the address line, if you click that, that will bring forward the patient's address. But since John, her son, in this case lives in Wilmington, Delaware, just enter in his address. And once we're done with this, we'll just save it. Then we'll move forward to inputting the patient's insurance information. So we select the relationship and mark it as her son. Save the chart. Now we'll select the insurance icon, which is the shield, towards the middle of the toolbar. So we will go to the middle tab folder, select the insurance type. In this case we're going to select Medicaid. There's no injury involved, so we'll just put other and Massachusetts as the state. Now we can't enter in the authorization information yet until we select the insurance carrier. In this case we're going to create a new insurance company. We're going to put BMC HealthNet, which is the prominent Medicaid provider in the Boston area. We'll input their address. Now this is strictly the company's information, their billing address. Now the company type in this case is health. It's health insurance. So we select it and save it. Now we can select BMC HealthNet in the drop down, and we'll go back to setting up the pre-authorization information. Put in the authorization number. We can enter in the number of visits. What's important here is we have to select, is this related to an episode for home health care? We need to select yes. Given by is either the case manager or the claims adjuster. So we enter in the contacts information and their phone number, and we save it, and that creates our authorization record. And we exit this screen, save the insurance information, and exit here, and that completes this step. We created the patient chart and inputted the insurance information.